So hi everyone, we are very happy to participate again in this relevant event, this time presenting an implementation project in Hospital Clinic of Barcelona to obtain normalized phenotypes in rare diseases scenario using natural language processing algorithms based on SNOMED CT. For the ones that don't know VTAC, we are a company specialized in terminology services located in the Barcelona Health Hub. It is a digital health organization. We are very grateful to the departments of clinical documentations and medical informatics of the Hospital Clinic of Barcelona for making this project possible. It is important to say that this work is included within the scope of the Spanish strategy for personalized medicine impact, precision medicine infrastructure associated with science and technology, coordinated by the Carlos III Health Institute. Specifically, this work is included in the data science program for the implementation of demonstrators of biomedical data integration systems for secondary use. Here we present the agenda structured into parts. The first one dedicated to present the background and scenario, and the second part to explain the case study, methodology, and results. The rare genetic diseases collectively impact a significant portion of the world's population. For many diseases, there is a limited information available, and clinicians can find difficulty in differentiating between clinically similar conditions. This leads to problems in genetic counseling and patient treatment. Currently, hospital services include high-throughput sequencing for the analysis and the study of genetic background in patient disease. Next-generation sequencing techniques have made it possible by improving the efficiency and reducing time needed to diagnose rare diseases. Whole exome analysis produces a series of genetic variants that can be cause of disease or syndrome, where analysts have to identify the one that really produces the patient phenotype. To make the process faster, the patient medical history must contain a precise and standardized description of patient phenotype. But clinical reports used to be written in human natural language, what makes more difficult the algorithm performance. For precision medicine purposes, capturing the deep phenotyping or the precise and comprehensive analysis of phenotype abnormalities is crucial. Here you are some examples such as the findings of electromyography study, positive SAR waves, reduced amplitude of the action potential, etc. In this context, the phenotype ontologies such as HPO or ORDO aim to standardize the collection of phenotype data, making it accessible for computer analysis. APOT is widely used in the rare diseases community for differential diagnostics, phenotype-driven analysis of next-generation sequence variation data, and translational research. Specifically, HPO can be combined with different computational phenotype-based gene prioritization tools, including such as Phenomizer, FinGene, etc. The algorithm is able to make a variant list prioritization using variant call files and HPO terms. But these protocols have limitations. All these tools require manual entry of an individual's clinical signs and as input to identify a prioritized list of candidate genes. Oftentimes, only limited phenotype information about an individual is provided on a test requisition form. Currently, the use of HPO is not fully integrated into the clinical setting, so the variant identification causal is dependent on the analyst, which translates into very costly terms in terms of time and possible human errors. Although the main domain of HPO is rare diseases based on OMIN, Orphanet, and Decipher, currently new terms in other domains based on PubMed, Mondo, or the Human Metabolome database annotations have been included. The cross-reference to other related terminologies such as SNOMED CT or UMLS and annotation to diseases through orphanet or roaming codes and associated genes allow shared data between systems. HPO has been reported to map 54% on UMLS and only 35% on SNOMED CT. But UMLS, for its part, as a standard terminology integration system, can facilitate mapping between HPO and SNOMED CT, being possible partially or completely, depending on whether both terminologies share concepts with each other. However, due to differences in focus and granularity, equivalence between HPO and SNOMED CT is only possible for 30% of HPO classes. New developments carried out by the Genomics and Precision Medicine group of SNOMED CT are going to include mappings between SNOMED CT and HPO that will solve the limitation of mappings through UMLS. In this work, it was designed a complete pipeline for extracting medical concepts from clinical reports with their subsequently association to the corresponding HPO terms by manual or automatic mapping. Due to that, this is a retrospective work. We do not have information about the HPO terms obtained by experts in the Hospital Clinic of Barcelona. So we perform the manual extraction of the terms. At the same time, we process it automatically, the clinical notes using NLP techniques. In a second phase of this project, in a future prospective work, the computational phenotype-based gene prioritization tools will allow to make a comparative between the variant lists prioritized by manual association and automatic mapping of HPO terms. So the results obtained will allow to confirm that develop procedures that can be used as an analytic support for genetic variant identification and validation in the field of clinical diagnosis. To carry out the corresponding test, 90 case studies have been selected by the medical informatics and documentation departments. The criteria was having a rare disease and having undergone a genetic test, preferably a massive testing. These cases include neurodevelopment disorders, retinopathies, neoplasias, neuropathies, muscular dystrophies, among others. For this pilot study, we selected 14 cases related to neurodevelopment disorders. The primary reasons for inclusions were developmental delay, intellectual disability, or autism. Related to manual mapping, we use the BRAT annotation tool. This tool allows to label the entity with a tag, in this case funding, and to introduce in notes the HPO code. We also categorize the mapping as equivalent or narrow to broad, etc. For automatic mapping, we use our tool Orbits. Orbits is an interoperability platform that integrates a terminology server with codification functionalities. Includes two different approaches for coding: string matching algorithms plus specific rules for each terminologies, long SNOMED CT and ICD-10 diagnosis and procedures, and NLP algorithms based on SNOMED CT. The tool also incorporates mappings and references between terminologies to integrate different systems. For this work, we use the APIs to obtain HPO codes through NLP algorithms. This NLP algorithm works exclusively in Spanish and is a hybrid model based on probabilistic and rules-based approaches. At this moment, can recognize 4 entities: clinical findings and disorders, morphologic abnormalities, procedures, including regime therapies, and substances, the ones related to drugs. As I said before, the entities recognition is based on SNOMED CT and returns SNOMED CT codes. Because the server includes mappings to other terminologies, we can obtain related codes such as HPO. All this process is possible by APIs that are FHIR compliant. In next slides, I'm going to describe the process. The clinical report is written in non-structured free text that is sent to the tool by APIs and returns a JSON file. The next visualization of the results comes from an application in the tool menu that allows send a piece of report and see results as a friendly way. Here you are the named entity recognition in different colors, disorders in blue, findings in green, and procedures in red colors. Also detect context, for example, negations, absence or fever, and personal or family history relationships. For example, parents are normal and have no dysmorphologies. This chart summarizes the entity's recognitions with the mention detected, the SNOMED CT code, the preferred name, the description that matches in the corpus. At this point, I would like to say that the knowledge database contains millions of synonyms that comes from different terminologies, including HPO, the category or label, finding, procedure, etc. The score, we are not considering scores under 85% for visualizing, and the context detection. The tool includes the mapping between HPO and SNOMED CT through UMLS. No category of the mapping is included in this case, equivalent, narrow to broad, etc. But the type of mapping, one to many, many to one, one to many or one to one is specified. So directly, we can obtain HPO codes from SNOMED CT codes. This is a diagram of the process. Both the NLP algorithm and the HPO to SNOMED CT mapping can be invoked through APIs, obtaining HPO codes ready for exploitation. This picture shows an example of the JSON responses, the SNOMED CTs, for example, for Pectus excavatum, and the related HPO code. This chart summarizes the results for the 14 cases, comparing the number of HPOs obtained manually and by NLP. And it also includes all the SNOMED CT obtained, taking into account the 3 tags related to phenotypes: morphologic abnormality, clinical findings, and disorders. We populate here the primary genetic finding for each case. Unfortunately, we don't have the information in 5 of the cases. Comparing to manual annotation, the NLP algorithm gets a 40% less of HPO codes, but considering phenotypes expressed in SNOMED CT, we can retrieve a 48% more of phenotype information. This low efficiency of obtaining HPO codes can be explained mainly because, first, lack of mappings through UMLS. We identified a set of new mappings, some of them here in this chart. Second, the missed deep phenotypes in SNOMED CT. For example, we can find some findings in the definition of a syndrome, such as short filtrum, but this finding has not a known SNOMED CT code. And the third reason is the difference in granularity assigning HPO codes. On the other hand, we obtain 48% more phenotypes represented in SNOMED CT using NLP, mainly due to the detection of negation, for example, no epilepsy, findings in the family that are relevant. For example, the subject has blonde hair and very white skin, but his parents have dark skin and hair. Detects normality, for example, normal electroencephalogram, and also detects disorders not represented in HPO, for example, the Hartsfield syndrome. In addition, for each case, further information can be detected, for example, treatments with valproic acid or procedures such as testing performance, karyotype, X-fragile study, etc. From these results, we can draw some advantages, limitations, and challenges ahead about the use of automatic HPO coding using NLP. As advantages, we can say that NLP detects entities with a high level of specificity, can detect normality findings, negation, and context. Also add relevant information such as procedures and treatments. Avoid manual entry errors, reducing human time-consuming efforts. The tool is continually learning with the incorporation of new mappings, SNOMED CT, HPO, and new synonyms in Spanish. As we mentioned before, the problem is that UMLS mapping is incomplete, and more detailed phenotypes, especially for these morphologies, are needed in SNOMED CT. And we have to deal with the duality of the disorder findings tag to define phenotype abnormalities. For example, hypertelorism is a disorder, but for example, epicanthus is a finding in SNOMED CT. With the release of the new mappings to HPO provided by SNOMED International and the completed Spanish translation provided by a Spanish translation group led by La Pulcina at the end of this year, we are very sure that the efficiency of the process is going to improve substantially. In addition, the terminology server includes all the terminology resources, relevant subsets, for example, ICD-10 or SNOMED CT terms for rare diseases, mappings to other relevant terminologies in this scenario, such as ORFA codes or gene associations, and LOINC answers and SNOMED CT to support all the terminology needs in the laboratory, allowing the integration between the hospital information and the laboratory system. So in summary, phenotype is relevant to interpret whole exome and genome sequencing results in patients with rare diseases. Clinical notes are most of the times written as pretest in an electronic system that computers cannot use for analysis. Orbit's NLP application provide linguistic and semantic annotation for unstructured free tests using SNOMED CT dictionaries and include RESTful APIs to obtain HPO-related codes. These concepts and relationships can be used to encode clinical narratives and can just substantially reduce human time-consuming efforts, saving time for clinicians and researchers. Phenotype ontologies allow interoperability between registries and other resources, such as biobanks and omics databases. And finally, once new resources, especially mappings, SNOMED CT, HPO, and the updated Spanish translations can be incorporated in the tool, we will be able to run a prospective study and demonstrate the advantages in computational phenotype-based gene prioritization process and diagnosis. So thank you very much for your attention. And now my colleague Mireia and I will be happy to answer your questions. Thank you very much.
Thank you very much. Gloria will now be joined by her colleague Mireia, and I'll take some questions. So I'll first look and see if there's anything in the room at present. Perhaps as you're thinking about your potential questions, I'll go to one of the online questions. So the first question I have here is, it seems the interoperability platform you present is able to solve other possible scenarios. What are they, and are there other clinical terminologies involved?
Okay, so can you hear me?
Yes, loud and clear.
So yes, in fact, we are going to present in the next LOINC conference the next month the project that we perform implementing this tool, this terminology service in a regional area of Spain and in Extremadura for reporting notifiable diseases, to support the reporting of notifiable diseases. So in this scenario, there are other standards working, such as LOINC, to normalize all the laboratory testing orders and results, codifying from the primary care ICD-10 codes to report automatically the notifiable diseases, and also SNOMED CT to obtain all the epidemiological information from clinical reports using NLP. So yes, we are implementing this terminology service in this scenario and others. I don't know, Mireia, do you want to add other scenarios?
Yes, I think I could add that in the same hospital where we have been performing this project, we are running the tool on daily basis related to the electronic health record in order to promote the clinical course of the patients related to health problems. So the idea is coding real time with ICD-10 and afterwards directly to SNOMED CT in order to have all the health problems related to each chapter of the electronic health record of the patient.
Okay, thank you very much. I do also want to mention that during the course of your presentation, there was some live tweeting going on Twitter from a clinical expert in the field saying successful precision medicine requires deep phenotyping of humans. Expanding structured data in the EHR will improve genome screening. This team is doing great work in Barcelona. So I thought I would share that for you so you would know that that was out there. There's another question here, I think maybe that would be interesting online, which is the evolution that you expect for this NLP based on SNOMED CT?
Okay, so first of all, we want obviously to add other hierarchies because at this moment, it's able to, as I said in the presentation, it's able to detect clinical findings, disorders, morphological normality scales, and at this moment can detect scales and assessment. But we want to add other hierarchies such as specimen or organism, and also we have in our roadmap to include long terminology to detect observables. And at this moment, we are very happy because yesterday both organizations announced an agreement of synchronize these two standards. So yes, we want to in the near future to apply other algorithms to detect observables entities, such as laboratory testing, clinical testing, biomarkers. Yeah. Mm-hmm.
Great, that's encouraging. Thank you. We have a question in the room from Dr. Charles Guttridge.
Hello, Gloria. I think we've met in the past. I'm still not completely clear whether all of your work is based on NLP of free text in the record, or whether there are problem lists using SNOMED CT or other sources, which you include as well.
So I would say it depends on the type of projects. No, for example, in some projects we use the terminology server and the NLP, but sometimes we only use the terminology server and the SNOMED CT, depending on the project. No, for example, in HPO we have been using human annotations. No.
Yes.
No.
Yeah.
Is that answering your question, Charles?
Charles, yeah, he's nodding. He says that answers his question.
Okay. So sorry. So depends a little bit of the approach of the project. We have this suite of tools that have string matching algorithms for coding and natural language processing, and we have a terminology server, and the combination of both is different in each of the projects.
Yeah, for example, we are coding all the microorganisms to SNOMED CT only using the string matching capabilities of the tool. So it depends on the project and the normalization needs. Yeah, sometimes we have to use NLP because we have to detect, it's relevant to detect the context, etc. But in some cases, it's not necessary to detect, because, for example, in a list of health problems or a list of treatments or this kind of mappings, that detecting the context is not crucial. You know?
That's it.
And another encouraging nod from Charles. So you've, I think, comprehensively answered his question. Thank you.
Thank you.
Seeing no other questions in the room, I will thank you, Gloria and Mireia, for making the effort to be an online presenter at our online and on-site conference. Thank you so much for sharing with us your work, and this recording as well as the presentation will be available online for individuals to consult after the event. So with that, I'll conclude the session, and let's give our presenters a round of applause. Thank you.
Thank you.
Thank
Bye.
you. Bye.
Bye.
Bye.